Low testosterone, or low T, is defined as 2 single samples of total testosterone levels, taken in the early morning, below 300 nanograms per deciliter, according to the American Urological Association guidelines for the evaluation and management of testosterone deficiency. Low T levels have been associated with a reduction in overall health and quality of life, and with an increased rate of cardiovascular events, including acute myocardial infarction and stroke, and lower bone mineral density, specifically osteopenia and osteoporosis. Also, men with diabetes and low T have greater difficulty maintaining reasonable glycemic control. Symptoms are very nonspecific and include low energy, afternoon fatigue, reduced strength and endurance, reduced response to exercise, reduced work productivity, loss of muscle mass, increased fat mass, irritability, feeling depressed, cognitive problems, decreased sexual desire, erectile dysfunction, decreased frequency of spontaneous nocturnal or morning erections, delayed ejaculation, and difficulties achieving orgasm. If you need T therapy, several options are available. Let me explain the options to you. Just remember, before starting any T therapy, a baseline evaluation is needed to make sure the T therapy is safe for you, especially considering if you have sleep apnea, high baseline hematocrit, gynecomastia, or prostate cancer. Low T treatment options. First, non-pharmacological options. It is well known that increasing physical activity and reducing weight if obese or overweight favor the consumption of foods rich in fiber, vegetables, and fruits. Improving sleep, getting 8 hours of sleep, and treating sleep apnea if present, and reducing stress will help you increase your T levels naturally. And second, pharmacological options include oral T medications, which come in 2 forms. One is direct oral T medications, which must be taken daily, twice a day. Those that can be affected by food intake, with increased absorption when taken with fatty meals. It should be avoided in men with liver issues. It has some issues to be covered by insurance, and most of the patients pay out of pocket. The second option is clomiphene citrate and enclomiphene. These medications are not testosterone. They are medications to increase your own testosterone production, stimulating LH production at the pituitary level, which ultimately stimulates testosterone production at the testicular level. We know that if the baseline LH levels are 6 or higher, these medications will not be effective in increasing T levels. Also, it has some issues to be covered by insurance, and most of the patients pay out of pocket. Another pharmacological option is nasal T therapy, which has to be applied 3 times a day, and it must be applied to each nostril each time. The same before, it has some issues to be covered by insurance, and most of the patients pay out of pocket. Many patients like to use topical medications or topical T gel. These are applied to the skin, on the shoulders and arms, once a day. It is essential to practice hand hygiene after using T gel to minimize the risk of T transfer, especially to children under 12 years of age. Dosage will be adjusted depending on the testosterone levels obtained. And also, it has some issues to be covered by insurance, and most of the patients pay out of pocket. Finally, other options are injectable T. For this group of T medications, there are 3 options: intramuscular testosterone, subcutaneous testosterone, and depot T. For intramuscular testosterone, the T will be injected into the muscle, most often in the thigh, on a weekly basis. It is critical to have training and be educated on how to prepare and administer the medication to administer the correct weekly dose. Dose will be adjusted depending on the testosterone levels obtained. For subcutaneous testosterone, the T will be injected into the abdominal fat area, easy to apply, on a weekly basis with minimal pain. It is critical to have training and be educated on how to prepare and administer the medication to administer the correct weekly dose. Dose will be adjusted depending on the testosterone levels obtained. It has some issues to be covered by insurance, and most of the patients pay out of pocket. And depot testosterone, which can be T pellets and other injectable depot testosterone. These are office procedures that are usually performed every 3 months. The number of pellets will be adjusted depending on the testosterone levels achieved at the end of the cycle, 2 weeks before the next dose. The other injectable Depot-T usually does not require a dose change. Regarding adverse events associated with T therapy, it is critical to discuss with the patient about potential side effects associated with T therapy during pre-treatment counseling, as most of them would depend on the pharmaceutical presentation. For all testosterone, possible side effects are worsening sleep apnea, polycythemia, increasing the risk of heart attack, stroke, deep venous thrombosis, and pulmonary embolism. Also, worsening benign prostate hyperplasia, gynecomastia development, decreased testicular volume or size, and reduced sperm concentration or azoospermia, meaning no sperm, leading to infertility. Specifically, other side effects associated with transdermal agents or gels include skin erythema or rash, and the risk of transfer to women and children. For clomiphene and clomiphene citrate, patients can complain of breast tenderness, blurred vision, potential bone density loss. It is mandatory to have a bone density scan every 2 years, and for clomiphene, the patient can report a low sex drive. For oral T, liver issues can be reported. For intranasal T, patients have reported nasopharyngitis, rhinorrhea, and epistaxis. For injectable agents, local site reaction, including site pain, hematoma, and a higher risk of abnormally elevated hematocrit, called polycythemia, especially with intramuscular T. For Depot-T, site pain and pulmonary microemboli. For subcutaneous pellets, very often there is some swelling and local discomfort for a couple of days. Polycythemia, pellet extrusion, infection, and hematoma have also been reported. T therapy is an option for men with low T. Never increase or change the medication dose by yourself. It is very important to follow your doctor's instructions and have the labs as instructed. That's it for today. Check out the rest of the videos on sexual health topics in my channel that I created to help you get better sexual education and improve your sex life. Please give me a like, share it, and subscribe. See you in my next video.